What is the survival rate for esophageal cancer? Esophageal cancer is a serious condition that affects the esophagus, the muscular tube that connects the throat to the stomach. There are two main types of esophageal cancer: squamous cell carcinoma and adenocarcinoma. Squamous cell carcinoma. This type of esophageal cancer develops in the cells lining the upper part of the esophagus. Historically, squamous cell carcinoma was the more common type, often associated with risk factors such as smoking and heavy alcohol use. However, its incidence has decreased in many Western countries, likely due to a decline in smoking rates. Adenocarcinoma. This type of esophageal cancer typically arises in the glandular tissue of the lower part of the esophagus near the junction with the stomach. Adenocarcinoma has become more prevalent in recent years, particularly in Western countries, and is often associated with gastroesophageal reflux disease GERD and Barrett's esophagus, a condition in which the normal lining of the esophagus is replaced with abnormal cells. Risk factors for esophageal cancer include smoking. Cigarette smoking increases the risk of developing esophageal cancer. Heavy alcohol use. Excessive alcohol consumption is another significant risk factor. Gastroesophageal reflux disease GERD. Chronic acid reflux, which can damage the lining of the esophagus, is associated with an increased risk of developing adenocarcinoma. Obesity. Being overweight or obese increases the risk of developing adenocarcinoma of the esophagus. Diet. A diet low in fruits and vegetables may increase the risk of esophageal cancer. Age and sex. Esophageal cancer is more common in older adults and is more prevalent in men than in women. Symptoms of esophageal cancer can include difficulty swallowing, dysphagia, unintentional weight loss, chest pain or pressure, worsening indigestion or heartburn, coughing or hoarseness, and vomiting. However, these symptoms can also be caused by other conditions, so it's important to see a doctor for an accurate diagnosis. Treatment for esophageal cancer depends on several factors, including the stage of the cancer, the location and size of the tumor, and the overall health of the patient. Treatment options may include surgery, chemotherapy, radiation therapy, targeted therapy, and immunotherapy. In some cases, a combination of these treatments may be used. Early detection and treatment can significantly improve the prognosis for esophageal cancer patients. Therefore, it's important for individuals with risk factors or symptoms suggestive of esophageal cancer to undergo regular screenings and seek prompt medical attention if they experience any concerning symptoms.